Addiction is a prevalent but often misunderstood problem. And in the addiction field, we consider it a disease. I like to think of it personally a lot like other mental illnesses, mood disorders like depression, that can be severe, that can be life-threatening. Oftentimes, it's not recognized until the patient is beginning to suffer consequences of his or her dependence on a drug or an alcohol, which is also a drug. In other words, getting in trouble with the law, beginning to violate their own moral code, having to tell lies, having to hide their problem, having to steal from and deceive the people that they care about. Their health is beginning to suffer, their job performance, their school performance, their moods, their mental health are beginning to suffer from their use of drugs or alcohol. Oftentimes, that's the signal that something is wrong. These folks who are suffering from addiction, if they try to stop, or when they try to stop, recognizing the problems that drugs or alcohol are causing for them, find themselves unable to stop. The addict is oftentimes trapped in a situation where he or she feels like they have to use drugs to survive. They have to use drugs to get through the day, but drugs they know are destroying them, are killing them. So they get to a point where they can't move forward, they can't go back, they can't live without the drugs, they can't live with them. Unfortunately, a lot of suffering goes on. A person suffering from addiction as just that, a patient who's suffering from an illness, who needs to be treated with compassion and understanding, who needs to get help from people who can help him or her, and needs to be treated as a person suffering from a disease rather than a person who's misbehaving. Young people are more susceptible to developing an addiction problem when exposed to drugs because their brains are still developing, including the complex parts of their brains, the way that they cope, their coping mechanisms, the way they handle stress, the way they feel reward for doing things that are good. In a young person, a teenager say, and we see patients with drug problems at ages as young as 12, 13 years old, is exposed to strong chemicals that create a feeling of euphoria or reward when they're used, their brains are changed and they develop differently. And there's a much higher rate of addiction problems in people who start using drugs at a young age and compared to, say, someone who started using in their adult years.